So in this video, I was planning on walking through the US healthcare system. I also would like to touch on a topic that is frequently discussed, a public insurance system. First, I want to talk about some basic terminology and concepts. Let's say that you have a person who's sick or hurt or in pain. They go to a doctor, nurse, or some other specialist that is in a hospital, clinic, or some other setting. There are also hospital administrators, executives, and others involved. This group is considered a healthcare provider. The healthcare provider will provide the patient with some good or service, perhaps an x-ray or medication, and they'll do that in exchange for some money. Sometimes the patient can't afford this, and this is why health insurance companies exist. The health insurance company will pay for most of your procedure. You will have to pay a small amount called a copay or deductible. A copay is just a small payment that you must make. For example, if a medication costs $300, then you might have to pay $20, and the insurance company will pay the other $280. A deductible is just an amount that you must pay before the insurance company chips in. So for example, let's say that you need a lot of medication. If you have a $100 deductible, then this means you must pay the first $100, and any amount over that, the insurance company will pay. The reason that these exist is to ensure that you don't go to the hospital and receive medication too often, because then the insurance company will be overburdened. Also, insurance companies will want you to choose cheaper medicines and procedures, so they will offer lower copays and deductibles for you to pick those. In exchange for a health insurance company having your back, you will have to periodically pay them an amount called a premium. Actually, a bunch of people will be customers of this insurance company, and they will all pay premiums. All the customers are basically just distributing their risk. This is why this is often called risk sharing. Health insurance companies are competing with each other to offer the lowest premiums to customers while also providing the best coverage. Another fact that you should note, they can negotiate for lower prices with healthcare providers. This is important to keep in mind going forward. The employers also play an important role in this. If you have a job, then you will know that many employers don't just offer you a wage, but they also offer you an insurance plan. The premiums that you would have to pay are often subtracted from your paycheck. Another important player is the government. Sometimes people have conditions that prevent them from making money, and the condition also causes them to require expensive medical care. For example, Medicare primarily covers people over the age of 65. Think about it. Many old people were not bringing in a consistent paycheck, so they couldn't afford to pay premiums. On top of that, old people tend to get sick or injured more often, so they of all people need coverage. Medicaid primarily aims to cover poor people, who also bring in no money but require care. The government also covers people with catastrophic kidney failure, ALS, also known as Lou Gehrig's disease, and also veterans. These government programs work very similarly, except instead of taking in money through premiums, it is funded through tax dollars paid by the whole country. Additionally, instead of a health insurance company negotiating for lower prices, it is the US government, which tends to offer a lot more money. As a result, healthcare providers are more incentivized to provide lower prices in order to win the government's money. Now that you have a basic understanding of the US system, I'd like to go over a few stats. According to the US Census Bureau in 2017, around 8.8%, or 28.5 million Americans, were uninsured. Around 37.7% are covered by the government, with Medicaid and Medicare accounting for 19.3% and 17.2% respectively. So these two government programs cost quite a bit of money. Medicaid spending amounted to $581.9 billion in 2017, and Medicare spending was around $705.9 billion in the same year. Additionally, people are living longer, so that means Medicare will have to be paid for a longer period of time. Around 56.0% were covered by their employers. I also mentioned before that around 8.8% of Americans, or 28.5 million people, are uninsured. These people are usually uninsured because they are too poor to afford the premiums, but also ineligible for Medicaid. As a result, when they go to the hospital for an emergency, they can be bankrupted. Strangely, they get higher prices than people who aren't poor, mainly because they do not have an insurance company or government agency to negotiate for lower prices on their behalf. Now I'd like to discuss America's healthcare system compared to other countries, mainly first world countries. Most developed nations around the world provide universal healthcare, and most of them provide coverage through public insurance plans. Basically, the idea here is that the government plays the role that an insurance company would. Instead of premiums, the public pays taxes. One of the major areas of debate today is what role the government should play in healthcare. One school of thought is that government involvement in this situation is a good thing. In particular, the idea here is that one big public insurance company would have a large amount of negotiating power. After all, if you were a healthcare provider and there was a giant company out there that would reward you with most of the nation as customers, then you would be incredibly tempted to undercut the prices of other healthcare providers. Because America doesn't have one powerful entity that negotiates prices for most of the country, healthcare providers can charge higher prices. So is this idea backed up by any evidence? Well, first off, it is true that Americans pay far more. In 2016, Americans' public sector expenditures on healthcare spending as a percent of GDP amounted to around 8.5%, which is in the ballpark of other countries, but private sector spending was far greater. Health consumption expenditures per capita are also much higher. So why are Americans paying more? Well, perhaps Americans are receiving better healthcare. For example, if two people bought a car and one person paid $1 million while the other person paid 10 grand, then the person who bought the $1 million car probably has a better car, maybe a Ferrari. Similarly, then they're probably receiving higher quality healthcare, right? Wrong. Let's take a look at a few medications and procedures. Humira, a brand name drug, is often prescribed to treat rheumatoid arthritis. The average price of Humira in the US is $2,669, but in the UK it is $1,362, and in Switzerland it's $822. The quality of Humira in these countries is the same. It is not like the Humira in the US grants magic powers. Xarelto, another name brand drug, is used to prevent or treat blood clots. The average price of Xarelto in the US is $292. In the UK, it's $126, and in Switzerland, it's $102. Once again, the same drug by the same company with the same quality costs more in the US. Harvoni is a drug prescribed to treat hepatitis C. In the US, it costs $32,114. In the UK, it costs $22,554, and in Switzerland, it costs $6,861. Truvada is often prescribed to treat people with HIV and AIDS. In the US, it costs $1,301, in Switzerland $906, and in the UK it costs $689. Tecfidera is prescribed to treat relapsing multiple sclerosis. In the US it costs $5,089, in Switzerland it costs $1,855, and in the UK it costs $663. Avastin is used to treat some cancers, and in the US it costs $3,930. In Switzerland it costs $1,752. In the UK it costs $470. Giving birth is also far more expensive in the US as well. The average price of a C-section in the US was $16,106. In Switzerland it was $9,965, and in Australia it was $7,901. The average price for a normal delivery in the US was $10,808. In Switzerland, it was $7,751. And in Australia, it was $5,312. Despite these higher prices, infant mortality in the US is higher than many other comparable countries. On average, Americans actually receive fewer coronary angioplasty surgeries than many comparable countries. The same is true for coronary artery bypass grafts. Despite this, the average price per angioplasty in the US is around $31,620. In Australia, it's $11,164. In Switzerland, it's $10,066. And in the UK, it's only $7,264. The average cost per bypass surgery in the US was $78,318. In In Australia, it was $28,888. And in Switzerland, it was $34,224. And in the UK, it was $24,059. People in the US have fewer doctor consultations per capita and shorter hospital stays than many other comparable countries. Yet the average hospital cost per day is higher in the US. When it comes to overall life expectancy, the US ranks 31st in 2015, according to data from the World Health Organization, and it ranks 43rd from 2010 to 2015, according to data from the United Nations. Let's look at survival rates from heart surgery and major cancers. The US ranks 5th in the 5-year survival rate for colorectal cancer and 19th in the 5-year survival rate for cervical cancer. The US ranks 7th lowest for in-hospital death rate for heart attacks, 16th lowest for in-hospital death rate for hemorrhagic strokes, and 4th lowest for in-hospital death rate for ischemic strokes. However, I should note that America has one of the best mortality rates for cancer. In fact, it ranks 1st in 5-year survival rate for breast cancer. But overall, in many areas the quality is often the same or worse, yet the prices are far higher. I should also note that a national health insurance program would save a massive amount on paperwork alone. Because of the administrative complexities in our current system, a massive amount of healthcare costs goes to marketing, billing, utilization review, and more. A single payer system could reduce administrative costs greatly. This idea is also quite popular. A Reuters Ipsos survey showed that 70.1% answered yes to the question, "Do you support a policy of Medicare for all when it comes to the US healthcare system?" 9.3% said they don't know, and 20.6% said no. There are actually so many things that affect healthcare prices, and here are just a few of them. First is defensive medicine. This is the idea that doctors in the US tend to get sued more often for malpractice. One side effect of this is that it leads to many doctors prescribing more diagnostic procedures than necessary. For example, the US is 2nd in MRIs performed, with only Germany surpassing it. As I mentioned before, this also raises the cost for doctors in the US, because now the hospitals have to pay more for the doctor's malpractice insurance. Another reason is longer patents and patent extensions. I previously mentioned that drug costs were higher in the US. If you discover a formula for a medical problem and it gets approved by the FDA, you can patent it, and you can be the sole provider of this medicine. This will allow you to price gouge, and people will have nowhere else to turn to. Think of it as your reward for discovering the medicine. Eventually, though, the patent will expire, and other people can make cheaper copies of your drug, called generics. This of course will force you to drive down your prices as well, even if it is name brand. In the US, pharmaceutical patents often last up to 5 years, and on top of that, companies can file patent extensions. There is large public support for making it easier for generic drugs to come to market in order to increase competition and reduce costs. Keeping on the topic of medication, certain laws exist to prevent the importation of cheaper alternative drugs from Canada, even if they were to pass certain tests. A recent poll shows that around 72% are in favor of allowing Americans to purchase prescription drugs from Canada. Medication costs account for around 10% of overall healthcare expenditures in the US. According to one poll, 1 in 4 Americans claim to have a difficult time affording their medication. So that's all for this video. If you liked it, please consider donating to my Patreon or PayPal so I can make more of them, and thanks for watching, and I'll see you later.